In this lesson, we will make an in-depth analysis of key principles of health equity and inclusion in assessments. Health equity and inclusion in assessments are grounded in principles of fairness, access, recognition of social determinants, anti-discrimination, cultural competence, community participation, and data equity. Operationalizing these principles requires robust frameworks, granular data, meaningful engagement, and systemic change. 1. Defining health equity and inclusion in assessments. Health equity is the absence of avoidable or remediable differences among groups, ensuring everyone has a fair and just opportunity to attain their highest health potential. In assessments, whether community health needs, clinical, or public health evaluations, equity means systematically identifying, measuring, and addressing disparities in health outcomes and their determinants. Inclusion is the intentional engagement of all groups, especially those historically marginalized, in the design, implementation, and evaluation of assessments. Core foundational principles of health equity and inclusion in assessments are grounded in fairness, equitable access, recognition of social determinants of health, anti-discrimination, cultural competence, community participation, and data equity. Fairness and justice ensure that processes and outcomes do not advantage or disadvantage any group, addressing historical inequities by comparing health outcomes across demographics to identify disparities. Equitable access ensures all individuals can obtain needed services by addressing barriers like transportation, language, or cost. Recognizing involves collecting and analyzing data on factors like income, education, and housing to understand their impact on health. Anti-discrimination ensures assessments are free from bias by using inclusive language and anti-bias training. Cultural competence emphasizes understanding and respecting diverse needs by translating surveys and involving cultural brokers. Community participation empowers affected groups through advisory boards and participatory research. Finally, data equity ensures accurate representation by disaggregating data and sharing findings transparently with communities. Operationalizing these principles requires systemic change, robust frameworks, and meaningful engagement. Frameworks and tools operationalizing equity and inclusion include the Health Equity Impact Assessment, HEA, which evaluates the potential impact of policies on health equity, focusing on vulnerable groups through disaggregated data, stakeholder engagement, and mitigation strategies. Racial equity impact assessments assess how policies affect racial ethnic equity using data disaggregation and community consultation. The 500's Health Equity Guiding Principles promote inclusive communication with person-first language and cultural humility. The HO's Health Equity Assessment Toolkit, HEAT, analyzes health inequalities using visualization and stratification by equity dimensions. Best practices for data disaggregation include breaking down data by race, ethnicity, gender, disability, socioeconomic status, and other factors. Go beyond minimum standards by capturing granular subgroup data, e.g., detailed Asian or Pacific Islander subgroups. Prioritize self-reported data for accuracy and trust, and ensure transparent communication about why demographic data is collected. Address missing data by using validated imputation methods and continuously improving data quality for more equitable insights. Barriers to equity and inclusion include a lack of disaggregated data, which limits the ability to identify and address disparities, perpetuating bias. Institutional biases such as discriminatory practices and embedded racism hinder equity efforts. Resource constraints, including underfunding and limited staff, are especially challenging in safety net settings. Exclusion of marginalized communities due to a lack of participatory approaches results in ineffective interventions, while inadequate leadership, tokenism, and resistance to change stall progress. Policy and regulatory challenges, including shifting climates and insufficient frameworks, further undermine DI efforts. Overcoming barriers to equity requires systemic change, authentic leadership, robust data, and community partnerships. This includes improving data systems by collecting and stratifying information on race, ethnicity, gender, and STOA factors. Address institutional bias through anti-bias training, equity committees, and culture change initiatives. Engage communities using participatory, rights-based approaches and partnerships. Allocate resources with dedicated funding for equity initiatives. Ensure leadership embeds equity in missions and metrics. Advocate for supportive policies and monitor progress with regular reporting and strategy adjustments. Integrating equity and inclusion in assessments involves disaggregating data to uncover disparities, engaging communities for relevance, and providing anti-bias training to reduce institutional bias. Equity-focused leadership ensures accountability, while resource allocation supports sustainability. Policy advocacy addresses structural barriers, and transparent reporting fosters trust through public dashboards and community feedback.